held virtually, so I invite all the participants to join also the virtual poster session. And thank you also for all the authors that have presented the work. And with that, I'll give the floor to Antonella Agodi.
So we have the first keynote speaker. I take care this keynote speaker because Professor Antonella Agodi is the director of my department, but at first a dear friend. Thank you, Antonella, for agreeing to hold this keynote on a very important topic for the earth and for the planet.
Thank you very much for the invitation, and thank you very much for being here, all of you, and on the Teams or on the Zoom. I hope that everything is working. Yes, the issue that we are talking on now is how climate change is linked to antimicrobial resistance, an overview of two intertwined global challenges. According to the WHO strategic priorities on antimicrobial resistance, preserving antimicrobials for now and for the future, antimicrobial resistance, AMR, is one of the top 10 global threats for the planet. And although antimicrobial resistance is a natural phenomenon, is also man-made. And drivers include the abuse of antimicrobials in humans, but also in animals. And that means the transmission of antimicrobial resistance and the emergency of antimicrobial resistance. Foods can be contaminated directly from the animals, but can also receive antibiotics determinants by animal manure used as fertilizer. So poor adherence to infection prevention and control can let the spread of antimicrobial resistance go on. Recently, oops, there is the switch off. Ma non nel mio. It is switched, si è spento. Okay. Okay, according to a recent paper that estimated the burden of antibiotic resistance, this is really very much heavy. And it has been demonstrated that attributable deaths and disability adjusted life years caused by infections with antibiotic resistance bacteria by a modeling analysis as the greater burden, and that 75% of this burden is associated with healthcare correlated infections. As you can see, the increasing burden is particularly seen on Klebsiella pneumoniae and Escherichia coli, which are gram-negative organisms and are sort of indicator of infections between the environmental domain, the animal domain, and the human domain. In a recent paper published last year, coordinated by Silvio Brusaferro, which is the president of the Istituto Superiore di Sanità, a focus was on E. coli isolated from the human domain and from the animal domain. And we demonstrated, participating also as site of the University of Catania to this study, that potential exchange of antimicrobial resistance determinants can be feasible, and thus it's very important to monitor the two domains that are strictly related each other. Okay. Data from the antibiotic resistance surveillance of the Istituto Superiore di Sanità. I think it's me. Of the Istituto Superiore di Sanità show the high-level proportion of multi-drug resistance organisms stably present in Italy. And as you can see, Acinetobacter baumannii, another gram-negative organism, very much diffused from healthcare-associated infection, is really high, as much as more than 80% of isolates are multi-drug resistance. And data of multi-drug resistance were also confirmed by the Italian nosocomial infection surveillance in intensive care unit project. This network is run at the University of Catania by our group, and data, as you can see, show the high level of multi-drug resistance organisms, and in particular Acinetobacter baumannii, Klebsiella pneumoniae, and Pseudomonas aeruginosa. Those three are a waterborne organism apart than intestinal organisms and very spread in the environment. So it's circulated, they are indicators of this circulating antimicrobial resistance. Recently on scientific reports, it was published a paper that demonstrates that gram-negative central line associated bloodstream infection peaks during summer. So there is a seasonality, not only for viral infections as influenza. Influenza has a seasonality. We know that there is a peak in influenza, but the bacterial seasonality is much more difficult to be explained because while influenza is due to crowding and climate variables, what determines bacterial influence in the hospital is more complex, meaning due to different components. For example, the turns of nurses, the ratio between nurse and patients, so the overwork sometimes in summer may be an explanation. But another explanation is that multi-drug resistance organisms, and in particular gram-negative, are environmental organisms and also waterborne. So they might contaminate sinks, and from sinks contaminate the patients through hands or through healthcare procedures. Also, antibiotic use is very important to be monitored. In 2020, the overall use of antibiotics was reduced, while the consumption in the hospital was increased. The ratio between the consumption of broad-spectrum molecules with the greatest impact on the antimicrobial resistance compared to that of the narrow-spectrum molecules was the highest in Italy, in Europe, and is worsening in 2020 compared to 2019. Again, data from the Spinuti network show a significant decreasing trends, which is a good news for fluoroquinolones and cephalosporins, and those are objectives of the national plan to combat antimicrobial resistance in Italy. So that's good, at least, but more work is needed still. How to combat antimicrobial resistance? Vaccination have been shown by our group in a recent paper to be inversely related with antimicrobial resistance. As you can see, the vaccination coverage against influenza is correlated negatively with antimicrobial resistance, and specifically against antimicrobial resistance Klebsiella pneumoniae and E. coli sustained infections, which is good. Where is the biological explanation of this phenomenon? Of course, influenza is a viral infection, so antibiotics are not to be used, and they are used inappropriately. Then we have, if we vaccinate, we have a decrease in influenza infection, so a decrease in bacterial complication of the influenza. So we decrease antibiotic use. And again, we decrease the antibiotic use improper and not prescribed. So it's a mean of appropriateness and quality of healthcare and prescription. Another paper that we have published recently was about the influence of the pandemic on the interest of people on antimicrobial resistance and related preventive measure. And we demonstrated that public interest in AMR was modest along and after the campaigns, the national campaigns. So we need to find better communication campaign, better models to modify the perception of people, because prevention is done with people, not on people. And here, addressing AMR will require concerted actions. In 2015, the WHO published the Global Action Plan on Antimicrobial Resistance. And the Interagency Coordination Group of Antimicrobial Resistance was convened, and its report was published in 2019. The title was striking, was "No Time to Wait," because the threat is really important. And antimicrobial resistance is a global goal together with the Sustainable Development Goal of the economic domain, of the environmental domain, and for the social domain. So it's a global crisis and a complex issue. Climate change affects health risks by affecting the most vulnerable through vulnerability factors as demographic, geographic, biological, socio-political, and socio-economical factors. Through exposure pathways like extreme weather events, heat stress, food security and safety, water quality, and vector distribution and ecology. Climate-sensitive health risks are already affected and range from injury and mortality for extreme weather events through heat-related illnesses, respiratory illnesses, vector-borne diseases, mental and psychological health. So climate change is strongly mediated by environmental, social, and public health determinants, and we should address all those. In this picture, you can find a striking photograph about the recent flood in the region Marche. Workers and volunteers at work in the province of Ancona. This is reported by The Guardian, and 11 people so far are being confirmed to be dead in floods that are forced climate crisis that was absent now to be present on the agenda just before the election. And climate change report 2022 issued by the Intergovernmental Panel on Climate Change has 3 keywords: impacts, that means studying and giving the evidence for the impact, the effect of climate crisis on health; adaptation, which are the responses to adapt and respond and contrast the health effects; and vulnerability, because climate crisis, as well as antimicrobial resistance, is going to affect the most vulnerables. That means women, children, the older people, people with underlying diseases and health situations. So the most vulnerable, migrants and the people that have no access to healthcare or minimum access to healthcare. So it's also a matter of justice and of combating inequality. Can the One Health approach save us from the emergency and re-emergency of infectious pathogen? As a research professional, I think that we have to learn lessons from 2 models. One model is the one offered by the SARS-CoV-2 pandemic lessons. We know that the virus came from bats and potentially use an intermediate source, the pangolin. And with climate change, bats migrate to more populated areas, increasing the interaction with humans. And COVID-19 patients receive empiric antibiotic without prescription or with prescription. The case of azithromycin, which is an antibiotic that is not recommended at all for COVID-19, and data again from the Spinudi network demonstrated a peak in the use of azithromycin, and so in antimicrobial resistance, are really striking. The second model, a biological model, is that one of honeybees. Honey is very much produced in Sicily, is our product, but honeybees are also a model for One Health organism because of their interactions with climate change, the environment, and the other animals. And more evidence and more studies are needed on this model to find solutions. Here's the synthesis of the issue. Climate crisis and antimicrobial resistance are the most important, greatest threats currently facing the planet. The climate crisis is impacting human health in different ways, and many of these impacts are affecting antimicrobial resistance. So evidence are showing that infectious diseases, including drug resistance infections, are spreading after climate crisis. Temperature is intimately linked with bacterial processes. More precipitation, as we have already seen, leads to flooding and flood-related infections. Pollutants are known to induce expression of antibiotic-resistant genes and bacterial mutagenesis. And microplastics are the hot spots for the transfer of antibiotic determinants from bacteria of different taxa. So pollution can physically be a driver of spread of antimicrobial resistance. You can imagine it's like an epidemic, not of organisms, but a molecular determinants outbreak of resistant genes. And so most countries present high multi-antibiotic resistance, and also aquaculture related bacteria related to multi-drug resistance from human clinical bacteria, temperature, and climate vulnerability. High use of antibiotics in livestock, but also in aquaculture, can be attributed to low compliance with regulation and poor antimicrobial stewardship. We know, and we said before, that illegality can be related significantly with antimicrobial resistance, and it had in a recent evidences published in the international literature. More multidisciplinary research and surveillance are needed, and artificial intelligence and machine learning can help us in scoring and finding new solutions and new determinants to focus on to combat this phenomenon. Unfortunately, there is really very few articles published so far using this approach, and so we should encourage the use of artificial intelligence on this topic. We have a participation in a national PhD program on artificial intelligence and public health, and one of our PhD students is in this PhD program, so we hope to have more results very soon. Finally, here, the impact of COVID-19 pandemic on antimicrobial resistance is striking. Antibiotics and the biocides and single-use plastics have been released in the environment, and it is really difficult to remove them from the environment, especially from water. And as for the effect of climate crisis of COVID-19 outcomes, this is conflicting results. What is sure is that climate crisis is going to have an harmful effect on cardiovascular events, increasing cardiovascular events and cardiovascular disease. And we know that cardiovascular diseases are a risk factor for a bad outcome with COVID-19, but more studies are needed. So I think that this Congress is a real opportunity to find new solution, new collaboration, new methods. And I'm sure that this Congress will find new solutions. Thank you very much for your attention.
Thank you very much, Antonella.
Sorry, just one more word to say that our department, Gianfilippo Ingrassia, is patronizing this Congress. And so we are very happy and congratulate with our friend and colleague Margherita Ferrante for this wonderful Congress.
Thank you, Antonella. Thank you very much. And I want Antonella at first in this Congress for KEYNOTE, for our friendly and for her support to me, to the conference, and to all life in the time.